Michael Bartholf. I'm a rising senior at the University of Pennsylvania, and I'm a federal affairs intern in this summer of 2017 at HIMSS. All right, my paper right here, I'm going to present on my paper, which was on mobile health, current state of mobile health, current problems mobile health faces, and the potential for future regulation within mobile health. Let's begin, shall we? Good. Perfect. So we're going to start with two definitions. The first is that of a medical application, which is what we're going to be talking about. It's a program that performs a particular task or set of tasks to alter the state or health of the body, and works on a mobile phone or tablet device. Peer review, don't have to read that too much. Peer review basically refers to what it normally does. It's just in this case, peer might go beyond who you think the usual peers are, and we can get into that in a second. Now, before we get into any problems or litigation or what's going to happen with regulations, we're going to start with the simple uses of mobile medical applications. And boy howdy, are there a lot of them. This one's a little bit different. So, among doctors, mobile medical applications are used for education, data management, electronic health records, communication, information gathering, decision making, and monitoring. Each of these green things right here are examples of applications that do that. In terms of patient use, well, if you have if you have like if you have an iPhone, you have your iHealth app. Something that comes right automatically with your phone, something that you can use to enter data into. We also have apps like SkinScan, something that I will get into on the next page. SkinScan posed a problem, though it has been changed, at least with that specific app right now, of trying to diagnose something with untested technology. That leads us quite well into our problems, both the real problems and the potential problems that exist. There we go. So, a lot of my little arrows and brackets have come out on this, but that's all right. So, in some of the research I found that it kept coming up were six potential problems. Sorry, 5. My goodness. Oh no, wait, 6. They differentiated with this, but let's get into that. First, we have diagnostic problems, something that your app will try and diagnose you, and it's going to be incorrect. You have corruption of data, which is pretty simple. The transmission of data is corrupted. Your doctor doesn't get what you see. You have decision-making problems. You have data loss problems. Your data is stolen, or you've lost reputation, which I'll get into in a second. This all has under questions of liability. So SkinScan presents an irreversible diagnostic problem. So let's say that SkinScan takes a picture of your melanoma. You think it says, oh, it's fine, it's not a melanoma, you're okay. But it turns out it was a melanoma, and you die later of skin cancer. That's an irreversible clinical decision, and one of the reasons why SkinScan was removed from the marketplace, and the FDA kind of wrote in a regulation specifically for it. But there are other problems from this. There are other problems that can develop from this. There are reversible diagnostic actions. For example, let's say you have a running app that transmits data to your physician, and that you can use to find out, how far you're running, how far you should run to try and lose weight. A reversible clinical decision would be, say, the app accidentally telling you to run a 1/10 of a mile. It's not going to be that problematic for you, and you can change it with a little bit of change in the code. But it is a problematic diagnostic decision. The data that app could send to your physician could be corrupted, either reversibly, that they switch characters around and you can kind of determine what it is, or irreversibly, that it's so garbled that no one can find out what the app was trying to send, and that creates problems. Your physician could make a problematic decision with the running app, telling you to run an extra mile farther than you really should be running with that condition. And the decision can also the app can also be misused. For example, let's say it tells you how many calories you burned on each of your runs, but you use this as gospel truth, and suddenly it says you burned 200 calories, you burned exactly 200 calories when that's really not the case. Then there's data loss, something like theft, which is pretty simple. They steal your running. Someone from the outside steals your running data. Or sale. The app starts selling your data, saying, hey, Target, this person's running 5 miles a day. Why don't you send them? You can use this to send ads to them for running supplies. Furthermore, reputation loss is very similar to data loss, except from the company's perspective. So a reputation loss and theft, there should be a line there, but it's very faint. Basically, if an outside source stole, say, the algorithm a company uses to determine how far you've run, or if failure in function, that the app just crashes the second you open. So when a medical app fails, and sometimes as we've seen with SkinScan, it has the potential to fail very, very badly, who's liable? That's a question I tried to look into, and one that unfortunately does not have that straight an answer. So basically some of the key questions when we're talking about liability of mobile medical applications are the responsibility for the data transmission errors, who's responsible when the medical application fails or fails in its medical functioning, what happens if doctors were involved, does that increase or decrease the responsibility and liability of your company, and to what degree? When does the sale of customer information data constitute a breach of privacy? And furthermore, does liability go beyond the practitioners and the developers of the application? Is Apple at fault for selling an app like SkinScan on its store? So, looking into liability in trying to find precedent for this was a very mixed bag. There only was one suit that I could find for, against a mobile medical application, and it was dropped without any result being received. So we're going to try and piece together precedents to the best of our abilities. Firstly, we can find that developers can be sued for the functioning of an application. Basic as it is, that is very important, obviously, because if they couldn't, then none of this could really matter. The example was an app called Go Live Mobile, which basically tricked people into using a premium texting service, and they were sued for millions of dollars and lost that suit. Privacy and security matters are a bit trickier when it comes to applications. Well, there was one lawsuit that was brought and continued against Apple for tracking individuals' locations. However, the judge stipulated that this tracking of applications. The judge stipulated this tracking of persons with this application did not constitute a breach of privacy, so nothing right there. We have that MD Live app, which was the only medical app that was sued for apparently allegedly sharing information with third-party providers. And the suit was dropped, so we have no idea what would have been ruled there. And security carries responsibility, but it's also uncertain. Home Depot was sued over its major data breach, which includes stolen data from apps. But, how far does that go? How far do you need to do the security? That's still unanswered. And the responsibility of your stores and your carriers varies. Apple has been sued for people purchasing apps. Mainly it was children who were purchasing apps without parent permission, so it can be sued for an application, though that's still very broad, and we don't know if it can be sued for carrying an irresponsible app. And carriers are generally not involved in these kinds of suits at all, mainly at best data transmission or texting problems.
What are the carriers again?
Verizon, AT&T. Now, generally, sorry about the lack of. So, in the main presentation, this should be sideways in 3D, so it makes it a little bit easier to see. But we're using slides, so we'll just imagine this says mobile app suit up there with a question mark. So, what we've determined is that developers can be responsible for the functioning of their application. That's been pretty well set by the Go Live Mobile suit. However, we don't know the question of whether a medical professional or an app can be sued for medical functioning as of yet. App stores and companies that run them can also be responsible, but again, we don't know about medical professionals and apps with medical functioning. It's unestablished whether or not the sale of customer data is a breach of privacy. And security can be responsibility of the developer, but it's uncertain how, say, HIPAA would be involved in this, and whether or not that would allow a mobile medical app breach would account a breach of HIPAA as well. And therefore, finding whether or not a mobile application can be sued for the improper functioning of its app is uncertain. There's a lot of uncertainty within it.
So before you go on to the next one,
yes,
the sale of customer data. I know that some states are battling that out. New Hampshire and Vermont have been, in particular, active companies that have sold data, which resulted in provision in legislation that has been battled out at the governor level. So I think you've got a great question, and it's still very much being fought out at both the state and the federal level.
When I attended a congressional hearing on this very topic last year, actually, that was the big question on most congresspersons' mind when they were talking about theft of data or sale of data. They did barely mention cybersecurity. They talked about what happens if this company sells it to Target. Is that legal? And that was a lot of the big questions. It kind of surprised me a little bit. Let's see. So there is current regulation for mobile medical apps, so let's get a good idea of what that regulation is. This is all headed by the FDA. Sometimes the FTC will get into that, but mainly the FDA. So mobile medical apps can be classified as mobile medical devices. As you know, there are three classifications of mobile medical devices, from least to most dangerous, 1 to 3. And very broadly, they go into more specifics online. These application regulations cover apps that turn mobile devices into medical devices. You plug your app into a heart monitor, and it allows you to function and monitor your heart. That's a mobile device that connect medical devices and complete their functioning. You have a blood monitor that you need to plug in and transmit data to your app for it to finish. Apps that use data from an attached medical device, and the FDA maintains discretion for whether an app could fall into these definitions. They were a little bit vague with that. That's a good thing because we can have problems when that happens. Regulations do not cover apps that promote general wellness, so medical reference materials, general aids, or general guides, even if they're horribly error-filled, are not covered by the FDA. So this then leads to some more questions on how far the power of discretion goes in this case. How far do the regulations go? For example, the FDA can regulate apps that use patient history for blood donors. Can it then regulate an app that say uses your patient history to try and diagnose a condition? That's uncertain. It doesn't really say that anywhere within the regulations. Does the FDA overregulate certain applications? That actually came up in several interviews that I did, that they thought that the FDA was going too hard against certain applications that really could be a 1, but there are 2 or 3, and that they're not going far enough for applications that really pose the scary diagnostic capabilities. And also, do other agencies have responsibilities? The FTC has removed several applications for what is deemed to be fraudulent advertising, kind of stepping into the realm of the FDA. One of those was an application that emitted a blue light that would cure acne. Yes, blue light can treat acne, but a specific kind of blue light, and not one that can be replicated by your phone here, and the FTC removed that application. So I have some proposed solutions to the situation. So I've had 4 areas I think where things can be improved upon. Firstly, I think one of the main points that we can see is an increase in partnerships between developers and medical professionals, a creation of a medical app review board, an increase in regulatory discretion to the FDA and FTC, and creation of a legal framework to give clarity and responsibility within future litigation. I shall elaborate on each one of them. Okay then, so partnerships between developers and medical professionals, this is a pretty straightforward one. It's another set of internal reviews. When you have a doctor working with you, they're just going to know how or when a little bit better how the medical functioning of a device should work, what's proper, what's improper, what's the correct information, what's not the correct information, that a developer just wouldn't know. This also means that it's going to decrease the likelihood of improper medical functioning. Such increased partnerships would decrease the likelihood of bad information that's precedent, and it would add a little bit more of legitimacy to applications. Hey, this app gives general medical information. Hey, this app is a doctor-reviewed series on medical information. It's a little bit more legitimate for people to look at. Of course, it doesn't improve security that much. Doctors generally don't know more about app security than application developers, and furthermore, doesn't guarantee perfect functioning. That legitimacy can be a double-edged sword. Doctor-reviewed might still fail. So, in that regards, how do you go back with this?
Arrow.
Oh, no, thank you. Sorry. I recommend the creation of a medical app review board. This adds an even further layer of review, but the thing is, you might be saying, well, the board can't review every medical app. There are thousands of those out there. And that's very true, but the medical review board can act as a place to report problem applications. Just by existing there, people can say, hey, I noticed on this application right here, it says that you should suck poison out of snake bites, when that's a terrible thing to do and can harm people. What do you guys think about this in the medical review board? And you could send the app to the medical review board, it can review it, it can mark it and say, hey, problems with this app, it's giving incorrect information. It can pinpoint problems in applications and applications that should be emulated. It can act as a nexus to bring together developers, professionals, and medical practitioners to try and help with apps and help in those partnerships we saw up there. It can act to write best practice guidelines or some best practice guidelines to help developers with those best practices. But it doesn't have the power of regulation behind it. And as we saw, spoiled already by my enthusiastic clicking, is the increase in regulatory discretion of the FDA and FTC. Now, I don't want the FDA and FTC to get into everything with big tentacle arms and reach everywhere in the mobile application world, but just have proper and good discretion about what can and cannot be removed. Both currently regulate and remove applications, but discretion basically I'm thinking about in this case is for diagnostic apps. It doesn't have as much discretion for diagnostic apps as you would think, and I think that's the major problem. These apps that say that they can diagnose something that aren't able to do so, and that can really harm patients when it fails to do that. That's the discretion where I think could go well. It gives legitimacy to the best practices in board decisions. Suddenly someone sees that, hey, all these apps that are marked well by the review board aren't being attacked or moved down by the FDA. Hey, that means the review board has some legitimacy backing it. The FDA could also stand to lower some device classifications. Again, as I stated before, with some the interviews, how they stated the FDA sometimes classifies something as a little bit too high or moves an application to a 2 when it really should be a 1. It could stand to lower some of those classifications, especially when it's going after the really dangerous diagnostic applications. The one problem with this is that it doesn't answer the legal questions. Eventually an app's going to get through, eventually someone's going to be harmed by a medical application. What happens then? Which leads to my fourth recommendation, which is the creation of a legal framework. It gives guidance to previous bodies on the legal responsibility of developers, practitioners, app stores, and probably not carriers. But if anything, if carriers could be involved in any manner, it could state how they would be involved in this. It leaves less uncertainty for the FDA and other bodies. If you know if your app fails and you'll be sued in this manner for up to this amount, that's a little bit easier than if you just might be sued, maybe, we don't quite know. Now, this doesn't substitute for precedent. The judges could say, well, I like your legal framework, but I think it's all, baloney, we can throw this right out. But it would help to at least give an idea of how a lawsuit could proceed, and eventually it's going to proceed. That moves to the conclusion. In the end, the state of M Health and its regulation, in the end, with the state of M Health and its regulation, all these recommendations I think could really help because, well, applications are going to fail and litigation is going to come. And you have to understand, will the government and the industry be ready at the end of it? All right. So that's the end of my presentation. I hope I didn't go too long, and I have time to answer any questions anyone has about this field, its current state.
So this,
Excellent presentation.
yeah. So the review board would be a kind of permanent one focus. So it wouldn't be product by product. It would be a permanent one that would be created to just look at medical apps to advise FDA.
Very much so. Yes, it would be permanent. It wouldn't have to review every single app, but it might review a representative sample, and it would be there to be able to maybe give a little certification of approval. Yes.
It almost sounds like the medical review board could also help delineate the fine line between a medical device, and a medical diagnostic app, if that's the term that can be used.
Definitely.
Seems like there's a fine line there.
There is, and sometimes it gets a little crazy. The actual regulation stipulates that the FDA can look into apps that use cameras to diagnose, but obviously how that works is a little bit strange, and they actually had to create a secondary regulation with the skin scan. It actually had to put in there, you see addendum, the FDA can regulate apps that attempt to diagnose skin lesions through things like fractals or pictures. Gee, I wonder why that was put in there. And so, yeah, I think that's very good, and I didn't think about that, about defining that very fine line. Yes?
And maybe I missed this, I'm sorry, I came up late.
It's okay.
The review board, would it be would we suggest it be a government entity, or would it be, or would, if the private sector or had a similar entity, FDA could endorse such an entity?
I think an endorsed private entity. I mean, I don't want to go too government heavy with all my recommendations, and I think that if the private industry came about and started to regulate itself, it would show responsibility, and people would be liable to trust it a little bit more. They're at least looking out for how their apps function.
HIMSS just got into, last November, we announced a partnership with the American Medical Association, American Heart Association, and a for-profit organization that it pulled together some standards around apps, and then the apps Morgan's Act is signing on, and there will be a big announcement in the next couple of days that they're the fifth member. What you're describing is maybe layering on top of that of bringing the medical, what apps should be, will work well within within the sandbox, being able to interact with EHRs, being standards-based, et cetera. What you're saying is potentially a layer over the top where AMA or American Heart or whomever volunteers some medical folks to be able to look at not only the structure, whether or not it works technically, but then is the information that's being shared medically sound?
But to me, I think something like exertion could actually.
Exertion. There.
I think exertion could do that
Yeah.
if they expanded their focus without being an additional layer. I think if you're looking at the standards of the app, you can also look at, you know, the legal issues that may become arise from that. It's different people maybe, but.
So, Michael, before you are finished with the internship, I would encourage you to look at exertion, see how it does fit into what you're describing.
Very much will. Thank you. Is there any other question? Oh, yes.
I have a comment. We talked a lot about adding the medical professionals, but I know we talk a lot about the role of the consumer in some of this.
Yeah.
And so I would think in your representation, you should mention that consumer should sit in some way on this board, since it's the health literacy, it's the inaccuracies, it's the other things that the consumers need to be protected.
Very much so, yes. These are great recommendations.
One of
Thank
the
you.
challenges of that we found, and Eli maybe will speak even more clearly to it, is when they created the HIT policy and the standards committee, they specifically brought in a consumer to help with from their perspective, but then it has evolved into organizations that represent consumers, and does that, does one perspective represent the whole, all of consumers' perspectives? So it's I think it's an important viewpoint to include. It's how you achieve that. Maybe there's some time before the end of your internship to think that through a little bit too.
I definitely will. Thank
In
you,
your
everyone.
In your research, did you see any, I don't know the right way to phrase this, but the relationship between FDA and FTC and sort of how they tackle similar issues in terms of jurisdiction?
Yeah, that was a very strange thing. It's kind of almost like the FTC just jumped in at certain points and then jumped back out. They'd come and say, hey, this app is fraudulent, removed it, and stepped back out. And the FDA, I think, was kind of saying, oh, well, that's nice, they came in and removed that. There wasn't a lot of cooperation between the two. It's not like there was a very well-defined framework. It's just kind of that the FTC would come in and remove apps that it determined to be fraudulent. And actually, a lot of these times, the FTC was acting when the FDA was kind of in the standby mode on medical applications. So, yeah, that would probably be something else I'd look into, is perhaps at least an increased role or partnership between the two of them for moving these
Sure,
applications.
especially as Congress is passing legislation sort of not really neutering the FDA, but taking away some of their oversight on some of these apps you're talking about.
Yeah.
It kind of leaves a void that the FTC sometimes jumps into and sometimes just doesn't.
I think the FTC could pretty easily jump in and come out and take a map that says it can diagnose something when it doesn't do that. It is pretty well, at least mine, online fraudulent advertising. All right. Well, thanks everyone for your comments. If there's any more questions or comments, all right.
Nice
Yeah.
job.
All right. There we go.
Karina will be our last presentation for today, and Sam and Katie will do theirs next week.
Okay, we're gonna